All right, it's the moment we've all been waiting for. Good morning and happy Saturday. My name is David Johnson, and I am assistant principal at Toledo School for the Arts, and I'm a member of the Project Impact Curriculum Advisory Panel. And so I've been asked to be a moderator for this session today. And so I'll be available kind of monitoring the time. I'll be monitoring the chat. If you have a question and you don't want to interrupt our speaker, or if something gets typed in the chat and gets missed in the moment, I will be watching that and make sure that it does get brought up at a time that might be more appropriate. Also, if we use breakout rooms, those types of things, if there's any of that that needs to happen, I'll be happy to facilitate any of that. Also, feedback for the presenter. If you have any feedback, you can directly chat that. If you'd be more comfortable chatting that directly to me, that would be fine. I think Carlin would also accept that directly to her. But we are looking for feedback. If you think about it in the moment, send it in the moment right over the chat to either myself or Carlin. That's gonna be great. So you are in Zoom room 5. This is the Pushing the Limit: Mental Health in Education During a Pandemic. Carlin Campbell Johannes is a colleague of mine at Toledo School for the Arts. She is the 11th and 12th grade counselor, and she is, before that, I know that she is actually a mental health professional. And so without further ado, I introduce Carlin Campbell Johannes. Take it away.
Thank you very much, David. Good morning, everyone. I'm very pleased to be here with you. I'm going to get the presentation up and share our screen. And we can get moving. So, as David has said, my name is Carlin. Here's our agenda for the day. We're going to do a little bit of introduction of who I am, who all of you are. We're going to talk some basics of what trauma does to developing minds, talk about some mitigating and exacerbating factors that are likely to be happening during this pandemic. We're going to make a couple of predictions about the future based on what we know has happened in previous pandemics. We're going to grab a couple action items that we can do as educators and within our institutions of learning. I've got some tools to share with you, and then a couple final notes of things to remember, and then we'll have time for questions and thoughts. Although please do chat your questions and thoughts at any time. David is monitoring the chat for those. So I want to say that no one is an expert in pandemic mental health, simply, especially not this pandemic, because there hasn't been enough time to develop expertise. But this is me. This picture was taken a year ago. I have not dyed my hair since then, so you can see what happens after a pandemic to someone's bright blue hair. Here's why I'm qualified to tell you about this. Even though there is no such thing as like an established seasoned expert in mental health during the COVID-19 pandemic, here's what I know. Here's my background. I started my career in mental health. I got my master's degree in clinical mental health from Ball State University. I've worked in a number of clinical settings, including hospital settings, private practice, community mental health. And then I got my school counseling endorsement from the University of Toledo, and I am now the, as David said, 11th and 12th grade counselor at Toledo School for the Arts. I used to also include grades 9 and 10, but a year ago we made the decision to hire a new 9th and 10th grade counselor, which is extremely exciting. Our population does have a high occurrence of mental health concerns. So my background in mental health clinically has really bolstered my school counseling to great effect. So that's who I am. I would love to hear who all of you are. If you could put in the chat what your role is, if you're a teacher candidate, if you're in your student teaching, if you are already an established teacher, if you're a school administrator, if I've got another school counselor or two in the room, whoever you are, I want to hear about it. Tell me something you're hoping to take away from today, and let us know if you have a pet with you on the call, and we'll look forward to seeing them pop into the screen. So I'll pull up the chat here. So yeah, just as we go, I've got some education majors here. Brilliant. And David's cat Ellie is a frequent guest in our school meetings. Hopefully she'll be with us today as well. We're likely to get a visit from one of my cats. We'll see how that goes. So here's what I wish I could be presenting to you today. I wish I could be telling you how we're going to fix this, how we're going to avoid all mental health concerns completely, how we're going to keep everyone completely at their peak pre-COVID mental health levels, how we're going to totally bypass the trauma that's happening right now. Um, oh, good. Oh, Stacy. Stacy is our 6th through 8th grade counselor at TSA. Oh, I'm delighted that you're here. Got some SPED teachers, intervention specialists. Oh, wonderful. Thank you, everyone, for letting me know who you are. That really helps me know how to figure this stuff. Brilliant. So this is what I was hoping to present. Here's what I'm actually presenting. Some basics of what trauma does to developing minds, some predictions of what is likely to happen to students and staff and everyone else mental health in the short and the long term, and some ideas of what we as educators and institutions can do to mitigate the damage. So let's go through a couple of basics. What is happening right now, and how can we think about that using frameworks we're already familiar with? Yay, scaffolding. Always here for some good scaffolding. We want kids to self-actualize. We want them to get to the top of that Maslow's hierarchy of needs, but they'll have a hard time with that if their needs aren't being met. So hopefully everyone in this room is familiar with Maslow's hierarchy of needs. All levels of the hierarchy are being threatened right now. Of course, there are limitations to Maslow. We know that people in extreme adversity can achieve great levels of self-actualization. And those limitations are worth paying attention to and thinking critically about. This is not the presentation to really get into the nitty gritty of what the limitations are, but we can use the framework that we have to give us a general idea of how to think about what we're seeing in terms of mental health. So at the bottom, we've got physiological needs. A lot of families are facing financial threat. School may be the only source of food. There are a million different things that we could put in this box. Just our students' most basic needs. Many of them are not as easily met during this time as they have been in the past. Needs for safety. Health is in danger when we gather in groups, and some students aren't safe at home either. We know that. We hate it, but we know it. We get up to the love and belonging stage. Connections with friends are likely to be suffering right now. They can't be together. And relationships with others at home may be strained. If you live with another human being, you have likely learned new things about them during quarantine that you maybe necessarily were not expecting to learn about them, and maybe you're not super thrilled about. We've all had experiences like that. Esteem is really hard to accomplish a whole lot when you're isolated. It's hard to feel good about what you're accomplishing when there's no one around to see it. And I think this is happening especially for a lot of our students. Other people may not recognize the effort that we're putting in. A lot of our students are just doing their best to get by, and the parents and others in their home just see them sitting all day on their iPad when they're really doing their best. So when we're not getting the recognition that we're working for, it's hard to feel like we have much esteem. And self-actualization, we know, is hard to achieve in the best circumstances. So when everything underneath it is not going well, it's going to be very challenging. If you are familiar with the term ACEs, would you put a 1 in the chat? And if this is the first time you are hearing ACEs, would you put a 2 in the chat? Seeing a lot of 1s, maybe a couple 2s rolling in. Okay. So ACEs are adverse childhood experiences. Dr. Bruce Perry and his Child Trauma Academy that was founded in 1990 are some of the forerunners in the field of studying what ACEs are. I've linked their website right here. Have a look at the ACEs website, the Child Trauma Academy website. The work that they have done, and the work that many others have done as well, is extremely enlightening and a little bit scary. There are ACEs quizzes out there to see how many adverse childhood experiences you have gone through. I encourage you to take it sometime. It may surprise you. Having adverse childhood experiences can lead to some really devastating long-term outcomes. Thank you, David, for putting that right into the chat. It can lead to mental health symptoms like, and this should not be surprising, you know, having an adverse childhood experience can lead to things like suicidality, depression, anxiety, insomnia, emotional disturbance, everything that's listed on this slide here. And these get all mixed around with comorbid physical concerns. They can lead to physical concerns. It gets really messy when our brains are not protected and given time to heal when we're young. ACEs can make a huge impact on what happens to us later. So this graph, not graph, I guess kind of, it picked it, this image, there we go, I found on the Centers for Disease Control, it's a very recent image that they've put together, and it shows us a really nice context of how ACEs impact us. At the bottom here, we've got general embodiment and historical trauma. Historical trauma, and I'll address this later as well. Historical trauma is not necessarily going through a trauma that's historically significant in nature, as it might seem on the surface. Historical trauma is intergenerational trauma. And the trauma of our ancestors impacts us, especially when we experience trauma as a large constituency group. So, on top of the historical trauma, we've got the local context that someone is born into. Those sorts of circumstances really matter. Then, on top of intergenerational trauma and the circumstances we're born into, then we finally have our own individual experiences. So, the ones in gray have nothing to do with anything we have done. Our own experience starts at that third level of adverse childhood experiences. And as you can see, the consequences begin to pile up. That disrupted neurodevelopment can lead to social, emotional, and cognitive impairment, adoption of risk behaviors, disease, disability, social problems, and early death. The numbers are staggering. I encourage you to go to the Centers for Disease Control. They did a study on correlating ACEs with some of these outcomes. And it's pretty startling. Don't type in the chat and then expect the button to work, Carlin. All right. So the symptoms of ACEs tend to decrease over time, although they can become chronic, especially with increasing numbers of adverse childhood experiences. Please keep in mind that our responses to trauma are usually reasonable and proportionate. It doesn't typically happen that someone goes through a trauma and has this gigantic, ridiculous explosion experience in response. Typically, human beings respond reasonably to things that happen in their lives that are not reasonable to experience. Now, that can be a big T trauma all at once. That can be losing a parent. It can be going through a cancer diagnosis as a child. It can be any big T trauma all at once. But a lot of the time, it's sustained little T traumas that keep happening. For example, living with a parent who's going through a mental health disorder, or going through occasional food insecurity. Those small T traumas are just as impactful as the big T traumas. So let's talk a little bit about shared trauma. That's really relevant in our context right now. I've heard this sentence a lot. We're all in the same boat. And the truth is we're not all in the same boat, but we are all in the same storm right now. But shared trauma doesn't have to become vicarious trauma. If you're familiar with the term vicarious trauma, pop a 1 in the chat. If you're unfamiliar with that term, pop a 2, if you would please. Shared trauma is when we're all experiencing the same thing. This is something that I'm seeing a lot of 2s. Great. Okay. So glad we're getting an introduction to this term. And it's really important as you're focusing on becoming a trauma-focused educator. We are all experiencing trauma right now. We're sharing it with our students, and that can make it really hard to support our students when we feel like we're in the same place they are. What do I have to offer this kid? I'm in the same boat, or at least in the same storm. But part of my goal for today is to make it so that hearing student stories doesn't have to hurt us too, so that we can be experiencing the shared trauma without turning it into vicarious trauma. And here I've got the note about what shared trauma is as opposed to historical trauma. So let's talk a little bit about toxic stress. If this is the first time you're hearing about toxic stress, put a 2. If you're familiar with toxic stress, please put a 1. So toxic stress, we've all experienced stress. Stress is the normal, healthy response to anything novel in our lives. We get a new cat, there's going to be some stress. Our house burns down, there's going to be some stress. Anything that's new in our life, our brain responds to with stress. That's our brain's way of developing and growing those neural pathways so that the next time we encounter that novel stimulus, it's not as stressful anymore. So stress is important. It's healthy. It's a good thing, but it can become toxic. And we've all experienced toxic stress at some point in our lives. But we're likely to be encountering it a lot more right now. And that is a physiological, emotional, and mental response to prolonged, extreme, or frequent traumatic experiences. So it's the same thing with when we're talking about the big T traumas and the small t traumas. Big T traumas and small t traumas can all lead to toxic stress. It can lead to experiences of uncertainty, boredom, feeling loss of freedom, isolation. This is a great quote from Bailey et al. In 2020. The isolation brought about by social distancing can exacerbate children's depression and anxiety. And that probably won't surprise us. If kids already have depression and anxiety, feeling isolated from support systems, of course, is going to exacerbate those symptoms. So, a lot of factors can make toxic stress even more problematic. If we don't have adequate information from public health authorities about what's happening, if we don't have enough supplies to get through the day, if we were already feeling financial stress before the pandemic hit and now I've lost my job or now I don't have access to the supplies that I need, I've got this financial stress. In addition, the stigma. A lot of folks, in order to make the financial stress minimized, are having to go into work in dangerous situations where companies are not taking the precautions they need to take. And that may lead to them contracting COVID-19. And there's a stigma that goes along with contracting this disease when they had no control over it. They were doing their best. So this is all contributing to the toxic stress situation that is not necessarily a helpful response, but it's our brain's normal response to these sorts of experiences. We need to talk about intersectionality real quick. Many segments of our society experience toxic stress daily, even when things are going quote unquote well. Racism is a horrible toxic stressor. Ableism, homophobia, transphobia, sexism, so many others really contribute to toxic stress for a huge number of people. And a lot of them overlap. There are some people whose identities and whose constituency groups put them in a lot of groups that are targeted by oppression. We have to take this into account if we're going to help. We have to take into account that not everyone can pull themselves up by their bootstraps. Lots of folks don't have bootstraps. A lot of folks are experiencing toxic stress all the time, and this is compounding that. And it's kind of an exponentially growing experience, unfortunately. So let's talk about some mitigating and exacerbating factors. I'm crediting Brooks et al. They did a 2020 literature review of psychological discourse as it pertains to past pandemics. So they took all the literature they could find about mental health circumstances during pandemics, and they put it all together in one beautiful study that I've linked to you later. Anything that's marked with an asterisk in this section indicates their work, to credit them and to save the slide space instead of having to go Brooks et al. 2020, page 2 every single time I credit them. So some mitigating factors that hopefully will help students not have as negative an outcome. A younger age is really helpful, and they all have this in their corner. Thank you, neuroplasticity. Young people have a lot of growing left to do, and that gives them an opportunity to heal and to have their brains process the trauma that they're experiencing. Also, curiously enough, lower levels of formal education seem to be correlated with better outcomes. Students have this. If they're students, that means that they don't have advanced degrees, although of course family experiences will vary. Also, quarantine factors. A quarantine, like a specific, you need to go into quarantine instead of just a stay-at-home order. The shorter the duration of that quarantine, the better the outcome. Although of course, quarantines need to have a minimum based on the disease and the incubation period for that disease. So it can't be like, oh, you quarantine for a day, I guess we're good. Obviously has to be a reasonable period that's going to serve the purpose of a quarantine. But the goal here is to keep the quarantine period as short as possible. And under 10 days seems to be kind of the golden number for keeping things minimally impactful. So here are some exacerbating factors, things that are going to make this worse. Students, a lot of them have increased responsibilities and decreased structure. I know a huge number of my students who are responsible for caring for younger siblings right now. Many of them have gone to work to help support their families. And during all of that, they've had decreased structure. They're having to take on all this responsibility without people giving them the structure that they need to succeed very well. Unsurprisingly, history of psychiatric illness and mental health concerns is likely to lead to less desirable outcomes and longer durations of individual quarantine. And of course, individual quarantine in the first place, as opposed to just a widespread stay-at-home order, is likely to lead to less desirable outcomes. Now, Brooks et al. Discovered that while these mitigating and exacerbating factors are likely to be relevant, evidence is not conclusive. So even the experts are not the experts in this, but this is the best of what we have right now. So let's look toward the future. Asterisks are going to behave in the same way in this section to credit Brooks and all of the folks who worked on that study. So in the short term, we're going to see a lot of things happening. Some avoidance behaviors will manifest after we're able to go back in person. A lot of people are going to be avoiding crowded and closed places. I know I will be. Some people will be avoiding all public spaces. I can imagine that it will be pretty alarming to see someone without a mask in public, perhaps even a large group of people without a mask, even if they're no longer necessary. Those are short-term trauma responses. Mental health symptoms will be acute. So acute as opposed to chronic. Acute is happening in the moment in response to something that has recently happened. And if those concerns do not become resolved, they can become chronic. But right now, in the short term, mental health symptoms are going to be acute. So getting help for them now is going to be really pivotal so that they don't morph into those chronic mental health concerns later that can also turn into physical concerns and all of those ACEs results. Of course, our students and ourselves as well are going to be grieving over lost loved ones who have passed away, over lost opportunities. We're going to be dealing with realities of new long-term disabilities that are resulting from COVID, even for folks who survive and recover. We're learning increasingly that even, this was really alarming to read, college athletes, so human beings that we consider at the peak of human health, if they were asymptomatic, so we've got an extremely healthy person who gets COVID but doesn't even exhibit symptoms, a large number of them are having lasting heart conditions. So we have barely chipped at the tip of this iceberg of what the long-term health repercussions are going to be. And that's going to be something we have to learn to deal with. And the short term of that is going to be a lot of grief, confusion, anger. In the long term, we're going to probably see some more avoidance behavior sticking around. I'm going to wash my hands and use hand sanitizer probably every 20 to 30 seconds for the rest of my life. I think that's just going to be a thing. I think, my godson and kids in younger generations are going to look and be like, why is Aunt Carlin washing her hands so much? You were only 3 when this happened, Muffin. Like the adults, we're going to have some things that are left over. Folks are likely to keep avoiding crowds for a long time. Normal as we know it is not going to be back for a really long time. We'll get there gradually, and one day we'll look around and we'll be like, oh my gosh, I can't believe that we ever wore masks. And man, am I washing my hands again? That's so weird. I don't need to do that anymore. We will get there, but it'll take a long time. Mental health symptoms are likely to decrease. Most mental health symptoms do. Some of them are likely to resolve entirely, especially if we're able to get help when things are acute. However, some mental health symptoms are going to become chronic, especially if they're complicated with grief, with leftover health conditions, and those are likely to lead to long-term harm. If you're familiar with the term complicated grief, put a 1 in the chat. If you're not familiar with the term complicated grief, put a 2. Seeing a little of both. So complicated grief is, it's not just your run-of-the-mill, my goldfish died and I'm grieving. Complicated grief is a very specific term in the grief community that includes grief over a loss that happened under complicated circumstances, perhaps a loss that was very quickly compounded by losing another person. There are a lot of reasons that grief can become complicated, and complicated grief is really tough to resolve. And we're going to be seeing a lot of that in the long term after this pandemic resolves. So we've talked about what's happening. Let's get some action items in here. We have been entrusted with our students' well-being, and sometimes we're the only source of support for students and families. I find that very frustrating. We've heard a lot about, oh, mental health, mental health, mental health. It's like, well, yes, of course, mental health. Of course, we need to be concerned about our students and their families' mental health. But so much of the time, schools are expected to be the source for mental health, for food, for healthcare, for a million things that schools are not always well prepared to deliver, especially in circumstances like these. So let's come up with some things that we can do to help. Note the asterisks crediting Brooks et al. So as a school, we need to provide as much information as we possibly can, both about what's happening in the world around us and in our communities, and about what our school is doing, why, how, when, etc. Um, Most administrations have connections with public health officials. We need to use those connections to direct information to where people need it most. Our students and their families are likely in the dark about a lot of things, and we have a chance to educate them on what's going on. That's going to help decrease the levels of toxic stress they're experiencing. We also need to be consistent in our decision making and in communicating those decisions as a school. If we're making new decisions left and right every single day, that's going to be an additional unnecessary stressor for students. And of course, as we've said this whole time, there are no experts in this. No school is like, we know exactly what to do. Here's our decision. We're sticking to it 100% because we know it's the right thing to do. Most schools are going to have to change their minds sometimes. That's the nature of the beast right now. And we need to be flexible as we make those decisions to the best effect for our students. We need to make it as consistent as we can, and primarily to be communicating those decisions as consistently, quickly, and effectively as we can. We need to help advocate and make sure our students and their families have what they need for functional daily living, internet connections and devices during times of virtual learning, um, things like that. We need to provide as many opportunities for interpersonal connection as possible. These students are having a hard time with social time. They're just not getting it. And for those of us who are in virtual education, um, it's hard to connect with someone that you just met over Zoom. You're only ever going to meet over Zoom, and they're supposed to be your teacher. As many opportunities as we can give these students to interact with the adults in their lives and the peers in their lives, the better. We can find links with community supports. If your school has a connection with a mental health counseling agency, now's the time to be banking on that. Partner with local agencies and practices. Get information about what resources are available, and then give people that information. Don't just hold on to it. Toward the end, when we have tools, I'm going to show you a resource guide I put together as part of my endorsement program at UT that I've continued to build. I'm giving it to you. I want you to use it. As individual educators, here's some ideas of what we can do. We can check in with students individually. In the tools section, I'm going to show you a check-in form that was developed by one of our teachers at TSA that I've modified for this. When you have a chance to actually connect with a student one-on-one, help them to identify the emotions they're feeling and perhaps even the reasons for their emotions. A student comes to you and says, I just don't have the motivation to do this. I just feel like I can't do it. You could say, like, it sounds like you're feeling burned out and discouraged. And that makes sense. We're in a pandemic. I haven't ever met you in person. This is really hard. And that goes right into listen and validate. These are a huge, huge part of the solution. There's only so much we can do to fix all of this, but we can listen and validate. Sharing the burden makes it lighter for everyone. That's why counseling works. That's why mental health services are effective, because when we share the burden, we have a chance to heal. We can also, and this was really interesting, we can encourage a sense of altruism that the sacrifice of quarantine makes a difference for the pandemic as a whole. This was discovered by Brooks et al. And I think there's a limit to what that can achieve, especially based on living in Ohio right now, when our governor is really hoping that we will all develop suddenly a sense of altruism that maybe not all of us are able to develop. But forcing someone to do something leads to less positive mental health outcomes than does cultivating with that person a sense of altruism, and that they are the ones choosing to make the sacrifices that are necessary to keep people as safe as possible. As individual educators, you can identify where resources are for your students within your school community. If there are counselors at your school, if you're based in a school, if there's a counselor in your school, please put a 1. If there is not a counselor at your school, please put a 2 in the chat. Seeing 1s. So far, all 1s. Oh, that's very encouraging. Okay, good. That's good. Use your school counselors. Lean on them. Tell them about when students are having a hard time. And obviously, I won't address if not. If there is not a school counselor somewhere that you ever end up, very early, figure out what your school's protocol is for students who need mental health help. So this is something I found really important. Self-care is great, but without good boundaries, it's just a band-aid. So let's talk about setting boundaries for ourselves because it is possible to push ourselves too far. We need to set boundaries for ourselves in a lot of different ways in terms of our time. Set a work time and don't vary from it. Don't do work outside of your work time. For technology, consider taking your email off your phone. I've never had email on my phone. I'm never putting email on my phone. It's a bad idea for me. I know that. That's a boundary I've set for myself. Set up a workspace that you use only for work if your home environment allows for that. With relationships, be mindful of the energy you expend for others. Communicate your boundaries to those people. Make sure that you're doing what you can for everyone without overextending yourself. If you're familiar with the term sleep hygiene, put a 1 in the chat. If you're not familiar with sleep hygiene, put a 2 in the chat. Okay, lots of 2s. Oh man, I was talking to David about this a short while ago, and sleep hygiene is a concept that I happened to encounter in my graduate program at Ball State. I needed it when I was 15. I don't know why everyone isn't talking about sleep hygiene all the time. It is so, so important. If you're experiencing mental health symptoms, burnout, trauma, really anything, our sleep is so foundational to our experience as human beings. And if we're not good custodians of our sleep time, our sleep space, our sleep routines, we're likely to suffer. And our students are in the same boats there. So if you can think of another sort of, and there's a resource for sleep hygiene at the end, or I'm not going to tell you how important it is and then leave you hanging. If anyone can think of another type of boundary that is important to set, go ahead and put it in the chat. I'm going to go to the next slide, but I'm going to keep an eye on the chat here. So boundaries, that's great, but how do we do that? The first step is to identify them, identify what the categories are and what you need those boundaries to be, and then set them, and then continuously evaluate them. So ask yourself questions like, man, am I okay with how that interaction went? Do I feel like I went outside of any of my boundaries in that? If you've got a slimy feeling about a decision you've made, it's likely that you violated a boundary. And we do not get to judge ourselves for pushing ourselves too hard. We love our work, we love our students, we work really hard at what we do. And we don't get to judge ourselves for pushing ourselves too hard because that's an act of heart and an act of kindness. And we owe it to ourselves to notice what's happening, process why, and make a change if necessary. Oh, I love this. Communication with students and parents, when and how, etc. You are so right about that, Tiffany. Absolutely. And part of boundaries also is teaching people how to treat us. And Stacy, absolutely no social media with parents and students. Quite so, quite so. We get to show people how they're permitted to treat us. And we do that through our communication, through setting boundaries, and gently and calmly but firmly enforcing those. I have an example of a no social media. It was a parent that I was friends with before I became the school counselor at TSA. I had taught this child violin lessons when they were very, very young. And then later they became one of my students at the school. And the parent would consistently Facebook message me, quote unquote, urgent things for the student about their schoolwork. They were never urgent. If they had been an actual emergency, something that I needed to address right there, I would have been grateful for the parent for reaching out. But these were things like, my kid needs an extension on her homework. Wow, we are not going to talk about that over Facebook. And I had to set that boundary with her multiple times. She consistently demonstrated she was not able to observe that boundary. And so I unfriended her. I do not currently accept friend requests from current parents or current students. But with that parent, it was a strange circumstance because I had known her before, but that was a boundary that I had to set. And then I had to go in, evaluate it, and make sure I felt like I had done the right thing. If you're familiar with the term compassion fatigue, please put a 1 in the chat. If that's a new term, put down 2. All right, so we got a couple 1s, but mostly 2s. Compassion fatigue is exactly what it sounds like. It's when our compassion muscles get fatigued. We've been doing too much compassion work. We've been perhaps compromising our boundaries a bit in order to provide compassionate help for people. And it expends more emotional energy than we are really capable of providing. It could be a real problem. So keep a close eye on yourself, on your energy, on your heart, and make sure that you're doing okay. This can be especially hard when the trauma is shared. Yeah, compassion fatigue. I should have like put together a slide of all these keywords: sleep hygiene, compassion fatigue, toxic stress, all of the hard hitting things. But there they are. So when we have opportunities to, it can be really helpful to help our students set boundaries too. Just as important as they are for us, they're also super important for our students. And for a lot of students, they don't have the agency to make a lot of very pivotal decisions for themselves. Most of them are minors. You might have a couple seniors who are 18, but most of them, decisions are made for them, not by them. So as much control as we can give our students over what is happening in their lives, the more of that they can have, the better. And boundaries are a really important way to do that in all the same ways that we have. So consider this. If you have ever experienced burnout in the job, please put a 1 in the chat. If you don't feel you've ever experienced burnout, put a 2. Stephanie, I think you hit it on the head right there. You just feel like you don't have more to give. Definitely. Timothy's had a lot of burnout. Yep. I think I've only seen 1, 2 so far. Everyone else has experienced burnout. It's hard to quantify what burnout is, but we know what it feels like. We have all experienced that at some level, probably even in a job that we chose that we liked. I've experienced a little bit of burnout in this job. There's a reason I'm no longer in mental health. It's because I couldn't outrun the burnout. But there have been moments where I felt like that compassion fatigue is getting to the better of me. I'm feeling the burnout. Think about how this experience is for students for whom school is not well designed. We know that school is really well designed for a number of students. They do really well. They don't have to work super hard. The structure makes sense for them. They're able to focus during the times we're asking them to focus. The work isn't super challenging. But a huge number, perhaps even a majority of our students, school is not a natural setting for them. Doesn't it make sense that they burn out a whole lot sooner, especially when we're in a sustained traumatic event altogether? We can help them avoid that burnout and the long-term effects of trauma if we're able to connect with them, help them identify their emotions, help them set boundaries, be encouragements to them. All right, so let's get some tools here. David, if you would please, could you copy and paste the link to that Google Drive into the chat?
You know, since you're sharing, I can't copy it.
Okay, that's all right, I can. You'll get
If you
to see.
email me that presentation, I'd be happy to make it happen.
All right, here's what I'm gonna do. I am gonna copy and paste it myself into the chat. I put together a folder of all of the resources. Nope, that's not what I wanted to do. What? Sharing? That's not the word I'm trying to type to you. It's on the last part. There we go. Whole link, including the word sharing. I want you to use these things. I brought a couple of things. The first is a weekly check-in form, weekly, daily, however frequently you want to use it. And I'm going to share my whole entire screen so you get to see the Zoom for a moment too, because I want to show you the 2 types of this form that I put in here. We've got an editable one and a fillable one. Do whatever you want with them. We use them as a Google form that goes to the counselor so the teacher doesn't have to triage, but teachers are welcome to make them their own. This one is based on a form created by Erin Latier, who is a social studies and ELA teacher at TSA. This first one right here is editable. Oh, this one's fillable. So you can actually click and type like, yeah, I'm actually struggling and I want to talk about it. It's been really hard. And then I can tell you some notes about it. But there's also a copy that if you want to change the wording on this, you absolutely can do that. Make this your own. But if you don't want to bother with that, you just want a fillable one, this one you can't edit any of the words on. So that's all in the form, or all in the folder. Once you get the results of this, check in with the students who have something they want to share, whether it's pleasant or unpleasant. And then you can refer to other resources as needed. There's a little screenshot of it there.
Carlin,
self-care check.
Carlin, can you make that a little bit larger? At least on my screen, when you share the whole screen, yeah, that's much better. Thank you.
Is that better? Okay. Yeah, thank you for that feedback. So the self-care check-in list. I found this a long time ago when I was working in mental health, and it has remained one of my most used resources. I'll zoom in a little bit so you can see it a little bit better. This is things to try and questions to ask before you give up. First, are you hydrated? If you're not, have a glass of water. Have you eaten anything? Have you showered? Just all of these ideas. This one right here, you may notice a gap. It says, do you feel unattractive? It used to say, take a goddamn selfie, but I'm giving this to kids, so I whited out the goddamn. Just take a selfie. Your friends will help you feel better. This is helpful for us. This is helpful for students. So please use this if you like it. There's a copy of that right there. I've got this sleep hygiene handout, long awaited sleep hygiene. So this is directed specifically toward young people and teens. Teens typically get 8 to 10 hours of sleep a night. If if as a teenager you got 8 to 10 hours of sleep a night, please put a 1 in the chat. If you are more like me and got closer to 5 to 6 hours of sleep a night, please put a 2 in the chat. um, yeah, yeah, a little bit of a mix there. Cool. Many of you actually did get the recommended sleep. I'm proud of you. Good for you. Let's help our students do the same thing. And this is another example of how school is not necessarily well designed for young people. Our school starts at 7:20. No, it doesn't. That's my high school. My high school started at 7:20. Ours starts at 8:05. Um, but it's still pretty early. And when students have really weird circadian rhythms, it can be rough. So this handout is really useful. Use it for yourself. Give it to your students. Give it to parents and family. So this year, our seniors were feeling really unspecial, and they asked us to do something about it. So this is one of the ideas that they gave us, which is senior pods. Is that text legible, David? Can you guys see that? Is it a little small?
Yeah, it's I have to move in, but also folks at
Okay.
home, if you're new to Zoom, you can also click view options on your screen and you can zoom in what's being shared for you personally, and then you can drag your mouse around. That's view options at the top where it says you are viewing Carlin Campbell's screen. So that's available as well.
Thank you, thank you, thank you. Okay. Adapt this for any grade, any group, anything. First, I emailed out teachers to say, hey, who's interested in having a senior pod? This is just a group of students to check in with sometimes. And I divided all the students in the grade, or you could do it in a group if you've got a group of students that you could think could benefit from this. If you want to do only one grade, if you want to do every grade, however you want to do this, then you send the faculty and staff a pod of those students along with their email addresses. And then the pod staffers just reach out once in a while. We have had an extremely poor response to this, but there's a reason I still brought it to your attention. Young people, especially high schoolers, have a really hard time actually engaging when they are offered support. That does not mean that the support is not useful to them. Just knowing that someone is out there caring about them sometimes is the most that they're able to absorb. And these pods are really good for that. If you get a great response and kids want to be coming in to play Among Us over Zoom with everyone, and everyone wants to talk and have social time and use that pod for that, then great. Consider that a fantastic response and an incredible success. But there's really no wrong way to pod. A lot of students just need to have someone reach out once in a while. And so there's that. And then the last thing I brought is a resource guide, and it's a little bit bulky. I'm not sure it's going to show it very well here, but I will try. Let's see if I can blow it up. Nope, sure can't. So this is very small text, but this is a link in the Google folder. All of these links right here are clickable, and it'll take you to the page with resources for that need. So a lot of this comes from the Lucas County Children's Services list of resources. I expanded it. I did everything I could think of. If you've got a student who has eye care problems, a family who needs legal help with perhaps someone is trying to evict them unjustly, domestic violence that may be going up right now as people are spending a lot of time around each other and not treating each other very well, transportation, pet care, everything I could possibly think of is here. Use these resources, give them to your families, add to them. Check the websites and the phone numbers once in a while to make sure everything is still active. But here you go. This is for Northwest Ohio specifically. Um, but if you're going to stay in Northwest Ohio, then you're good. If you're not necessarily staying in Northwest Ohio, then build something like this for yourself. So here we're back to our full presentation here. So I want to hear from you if you have any tools that you use, whether they're conversation starters, games to help engage with your students, processing strategies, um, anything that you use to engage with your students, help open the door for them to connect with you. And if they have mental health concerns, to get the resources that they need. Um, please put any ideas you have in the chat. Attendance questions. That's a good one. Yeah. So Ashley, could you expand a little bit on what you do with attendance questions? Feel free to unmute.
Yeah, so it's really just a random question, and I'll call one of the students' names and they'll answer it. So one that we did some time ago was, what's your favorite condiment? And then it turned into a slight debate about whether or not cane sauce was like better than a bunch of other sauces. But it was a great way for the kids to interact with one another, and then just for me to learn a little bit more about them.
And I agree with Stacy, the cane sauce is the best one. I love that idea. Very good. Tiffany, how do you conduct your informal morning meetings? That sounds like a great idea.
Yeah, so every morning, so my kids right now, I have 7th and 8th grade, and they have art very first thing in the morning. So I don't actually see them until 9:40. So that 15 or 20 minutes before we actually like really dive into academic stuff is, I do a welcome greeting with them, and then I do one of those check-ins. I have a mood meter that the colors are red, yellow, green, blue. And then I ask them, like, how are you feeling today? One of the colors, or are you somewhere in between? So if they're between red and blue, they could say purple. And each color has like a bunch of different emojis that go with it. So, they could be a combination, or they could just be red. Or I had a kid yesterday who said he was dark red because he just was having a rough day. And then, so after that, then I do kind of the same thing, like a question or like a would you rather, just to kind of, get the discussion going. And then I do a morning message where whether it's like an inspirational quote or I'm all about the growth mindset. So, if it's like a growth mindset quote, and then I just read it and we discuss. It's just an open discussion. I say, does anybody have anything that they want to share? Like, how does that, does that spark anything? And if they don't, they don't. And I just leave it. It's not like a required thing, but it's just kind of an open space for them to just talk and check in, really.
Brilliant. And Tiffany, what grades are you with? Grade or grades?
I have 7th and 8th grade cross-categorical special education. So I have 11 kids. They're mine. We do all subjects together. So
wonderful. Oh, that's so cool that you have a chance to really build that connection with all of them together as a group.
Yeah,
really
definitely.
nice. Oh, cool. All right. Well, we're going to keep moving, but if you come up with more ideas or you think of something that someone else has done that you've seen and really liked, please do put it in the chat. We want to learn from each other. So let's talk about a couple things to remember. We have been tasked with refining our own skills as trauma-focused educators during a time when we are also going through an immense sustained trauma. That is no small feat. We cannot overstate the challenge that educators have been given right now. We are expected to be everything and to be infallible and to have everything all together and to be growing and to be better than we've ever been during a time when we really need the flexibility to not be the best we've ever been. So have some mercy with yourself, have some compassion with yourself, with your colleagues, have as much flexibility as you can and kindness for yourself. Remember that severity will be a bell curve. And the last three things here are actually quotes, and I did not think at the time when I heard these quotes to credit the people who said them, but they were all just things that happened in meetings during the course of the school day. Severity will be a bell curve. If you're in education, you have gone through some sort of a stats class, some students are going to come out of this looking like nothing happened. We're going to be amazed. It's going to be incredible. We're going to try to look to them as examples of what we can do. but sometimes things just worked out well in their favor and they were a perfect storm of health. Most students will have something that goes wrong. Most students will have some sort of small lasting effect. And some students, some people will have really long-term severe consequences. That's that's how humans work. Remember that balance is never achieved. It is always maintained. That might be a David quote, actually. David, did you say that? No, he didn't. All right. Well, I would credit you if you did. It sounds like something you would say. We never perfect balance. We never perfect our boundaries. We never perfect our abilities, but we maintain things. It takes active intention to be the educators that we are and to keep the balance as much as we can. Um, Please be intentional about what you're doing. Small things and big things. Be intentional with your boundaries. Be intentional with what you're allowing yourself to consume in terms of media, in terms of feedback from others, in terms of communication, all of those things. um, yeah, so here are the works cited. I want to show you before we are totally done. First of all, this is my email address and my office phone number. You're welcome to contact me. Please do. I'd love to hear from you. If you have thoughts about how we can improve this presentation, about questions you have about anything I said, if you want to hear more about any of those buzzwords that I threw at you today, please do contact me. I am going to, thank you, David. I'm going to stop the share here and I'm going to show you the Google Drive. I'm going to blow it up so you can actually see the darn thing.
Carlin, I lost your extension.
Oh, that's okay. I'll put it in here. There we go. Extension 310. Oh, just send it to you directly, David. Could you copy and paste that to the whole group instead of direct? Thank you very much. All right, so here is the folder the way I have it laid out. Is that visible fairly well to people? Great. So here we've got the how are you editable document. If you want to edit what the words say, if you want to add in emojis, if you want to add in color gradients, do that. That's great. I've managed to fit 2 on a page. If you don't want to worry about changing anything, you just want a fillable version, there it is. Feel free to turn it into a Google form. Anything you want to do. The presentation itself is right here. There we go. The resource guide is here. The self-care check-in, the senior pods, the sleep hygiene handout are all right there. This right here, if you are like me and love a big juicy literature review, I've got a folder here with, these are the things that I referenced in the presentation. I kept going and was reading all the rest of these articles I found, and they're so good and they're so interesting and there's so much good stuff. But I immediately realized I have an hour, not 7 days. So I had to cut myself down to just referencing a couple of things. But I strongly encourage you, if you found some energy in this and you want to think more about it, here's a lot of really good literature about what we know about how pandemics and mental health, about disaster and mental health, about war and mental health, about lots of societal level crises and how they impact mental health. There are some articles about how to connect with young people who are feeling disconnected. There's stuff about what programs schools have put into place in different sorts of traumatic experiences. So have a look at all of this. If you find articles that you want to add to this folder, you are welcome to do so. Really, please use this in whatever way is going to be functional for you. So with that all being said, we have 7 minutes left. I would love to welcome any questions or thoughts, or if anyone has anything they want to expand upon that we've talked about together. Unmute yourself, bring it on.
Before we do that, I just want to invite everybody to give a little bit of gratitude to Carlin virtually in the chat, however you like. A very impressive presentation and well thought out. And so thank you very much, Carlin, for your efforts on that.
Thank you all very much. It's a real pleasure and an honor to be able to share some of this with you and to get some great ideas from you as well. I'm really, really thrilled. And then all the kindness just starts rolling in. Thank you, everyone, so much. That's very kind. If anyone had a buzzword that we went through that we didn't have time to really dive into and you want to think more about it, let me know. Let's talk about those words. We have a little bit of time left. The original version of my presentation had about 5 different scenarios about what would you do if a student's parent died, if a student got really sick in your class, things like that. And I was like, we don't have 7 days to do this, Carlin. So I had to trim it down. But if anyone has a scenario they want to talk about, um, that something faced your school and you have no idea how to handle it, anything you can bring. And it's okay if there's nothing. I'm just seeing that folks are taking advantage of the stop video, which I totally respect. I do that a lot in meetings as well. But if there's something you want to talk about, I'm here. I'm going to stick around. And I hope a lot of folks will too. But if you're ready to take a break, you are welcome to do that as well.
And yeah, so at 10:45 is when the next sessions do start, and you might have to scroll up because I made a moderator mistake. I put the file in there of the program if you still need that before I asked you to share your gratitudes. So before the gratitude is the file where the Zoom links are for the second sessions. This particular room 5, does not host a second session. So you'd be happy to hang out in here until 10:45. If a conversation gets started up and there's things, that's fine. But I do understand the need to use the facilities and get a coffee and things like that. But so that's the spiel. The room is open and Carlin is sticking around.
Thank you all so much for your engagement. I had a presenter once use the if you blank then put in 1, if you blank then put in 2, and I love that. It's like I'm doing that in every presentation from now on. So I hope that was helpful for you.
Thank you, Carlin. Love hearing your calming voice on a Saturday morning.
Thank you, Stacy. It was really good to have you here. I'm so glad you were here. Yeah, Kelsey, I agree, because I would have been just staring at a screen of all these beautiful pictures and names spelled out. But if I can have any sort of engagement with folks, that helps. And a lot of the terms that I am so familiar with, a lot of people aren't. That helps me know.
Christina, thank you for hosting. I don't know where the recording goes, but it probably goes somewhere on your end.
Yeah, no problem. So I guess we go back to the main room or whatever.